So here we're going to talk about tactile localization, and you can use an aesthesiometer, which in the clinic we usually call it a discriminator, and it says that on here. This is a tool that has 1 point and 2 point on it, and for the purposes of tactile localization we're going to use the single point. And we're going to, in this case, be touching different parts of our hand and arm, and you can follow the dermatome patterns that we've talked about before. And so not only are we going to touch their skin in the dermatome patterns, but this time we need them to also point to where we're touching. So, and that's the localization part. So of course their eyes need to be closed for this, and just before they start, you know, you educate them again on what you're doing. You kind of show them what that might feel like. You're going to just kind of hold it down for 1 or 2 seconds and then pull it back up and ask them to use their other hand to point where you were touching. Okay, does that make sense? Mm-hmm. Okay, so now if you'll close your eyes, and as soon as you feel it, just point to where I'm touching. Very good.
Static 2-point discrimination. This time we're going to start at 5 millimeters. Moving, we started at 8. Static will start at 5. And just like it says, merely pressing 2 points, 1 point. Okay? So you have your client close their eyes. All right. And same thing, you tell me if you feel 1 point or 2.
Okay. 1, 2, 2, 1, 2, 2, 2. I don't know. 1, 1, 1. 1, 2.
Okay. To 2-point discrimination, first we're going to test moving 2 point. There is a static, which we'll cover later, but moving 2 point tends to come back faster than static. For this test, you're going to be using a tool called a discriminator, and for instructions we're going to follow Pedretti on page 581 instead of your screening book. Okay, just for clarity. So a little awkward, it takes a little practice, and I even feel a little bit awkward too. So this is typically used on the fingertips, since that's where we tend to manipulate objects. Once again, the hand is placed. If you need to place it in putty, you can. On the discriminator, you'll note that there's 2 points and a single point. So you'll be alternating between 2 points and 1 point, and that's the discriminating test, is can your client tell the difference between 2 points and 1 point. We're going to start with 8 millimeters, and then we'll work our way down, hopefully down to the 2 millimeters. To test this, you're going to test the radial and ulnar side of the digit, okay, where the digital nerves. On moving, you'll start on the fingertip, proximal, and come distal, okay, and lift off. So you're not going to drag off the fingertip. It's not just a little tiny spot. You're going to go parallel to the finger, all right. If you went perpendicular, then you might be getting 2 different digital nerves, okay. And these are all mistakes that that you'll see made, but so we're going to start here with our 8 millimeters, and you're going to have your client close their eyes, okay. And I simply want you to tell me if you feel 1 point or 2 points.
Okay. 1, 2, 1, 2, 2,
2, 1.
So for a correct response, you're going to test them about 10 times. 7 out of 10 is correct. For her, when I got to 7, she was correct. There was no need really to continue to go on, okay? Some will, if they're getting every one correct, especially starting out at 8, some will go on down and try here, alternating with the point. How much pressure? Well, here just practicing with her, I've barely touched her. You don't want to press so hard that you actually scrape the skin. These are kind of rough, okay? So if she was correct at 8, we'd move down to 7. Once again, you have her close her eyes, and you can tell them this can be a little bit lengthy process for us to get down. 2,
2, 1, 2,
and what
1,
you may notice that I'm using, instead of swinging around to the single
1,
point, on these wider ones,
2,
sometimes
1.
you can angle that and get it. But I want you to practice, okay? It's awkward, all right?
Okay, so now we're going to be looking at sharp dull, and we're going to be focused on the hand for this. Just kind of to orient you to this diagram, this is what we'll be using us to guide us in where we test. So you can see here, spots 1, 2, and 3 are used to test the ulnar side of the hand. 5 and 6 are used to test the median side of the hand. 4 is used to test the radial side of the hand, but what you want to be careful of in this picture, it looks like it's kind of in the meatier part of the palm, but for it to truly test the radial side of the hand, you need to be more on this lateral side. Okay, and I'll show you that when we test also. The other part of the picture is here, number 7. This is the dorsal side of the hand, again along the thumb. Sorry about that. This will also be used to test the radial side of the hand. In terms of setup, you'll see that I've got her on putty, and what we're doing is we're placing her hand on a more secure surface so that when we test sharp dull, she's able to focus on the sensation of sharp and dull and not on the movement of her hand. So this stabilizes her hand so that she doesn't sense movement. If I just support her hand here and say I was testing light touch and I pushed on her finger, if I moved her finger at all, she's not only receiving information about light touch, she's also receiving sensation about movement. So we want to eliminate movement, and we do that by placing them on putty. When you test sharp dull, you can test with paper clips. You can use a paper clip if this one was still bent in its normal curled up position. You could use the bent rounded position for dull and the unbent position for sharp, which is also used to test pain. The other option is to use a safety pin. Okay, so again, this rounded portion being for dull and the pointed end being for sharp or pain. But obviously, if you pull this out with a patient, you're going to make them a little bit nervous. So it's really important for you as a clinician to explain what you're doing and why you're doing it. I would also recommend that you test it on yourself so that you know what it feels like and you know how much pressure to give. So for my patient here, I'm going to use a safety pin, and it's just to see how well you're able to distinguish sharp from dull in your hand. What I'm gonna do is this soft side is gonna be used for dull, and I'll show you on myself here. I'm just gonna be pushing on different places of your hand. Okay, versus the sharp end here. I'm gonna just push a little bit. It's not meant to be hard. It's not meant to cause true pain or, of course, draw any blood. I don't want to do that either. So I want you to experience that first with your hand that doesn't have any deficits and with your eyes open so you know what to expect.
Okay.
This, and I'm going to switch hands here. This is obviously the dull side.
Okay.
Okay, so you kind of get an idea of what that feels like. And then for the sharp side, this is what this feels like.
Okay.
Was that okay?
Mm-hmm.
Okay. So now you can kind of see the difference also between sharp and dull.
Right.
So we're going to do that for this hand. So when we're testing sensation, we're asking the patient to close their eyes. Some people are unable to keep their eyes closed for the duration of the test, and so what you might consider also is putting a sheet up in front of their face just to block their view of their hand so the test isn't skewed by their vision. I trust my patient though that she can keep her eyes closed, so I'm going to just now at this point I'm going to have you close your eyes and I want you to tell me when you feel either sharp or dull.
Okay.
And I'm going to use my paper to just help guide me on where to test. Okay, so here we go.
Dull. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Dull.
Now, for the purposes of instruction, I'm going to tell you guys that make sure when we do test the radial side of the hand that we really come out to the lateral side of the thumb when you're testing the volar side so that you can make sure you're capturing radial sensation and not median sensation. So I'm going to start testing again.
Dull. Sharp. Dull.
Okay, and now I'm going to ask you to flip your hand over. Okay, eyes are closed again.
Dull. Dull. Sharp.
Okay, and relax. You can open your eyes. So one thing you may have noticed again during this testing is you try and vary your speed so that they don't get used to responding in a timely manner. So don't hesitate to take pauses. Don't hesitate to repeat a test if you're unsure or if the client is unsure. That is okay also. Okay, so now we're going to be testing sensation in terms of hot and cold. And so sometimes in your clinic you will have sensory testing kits like this where we've just got cups with little dials in here that have a temperature gauge on the top. And so we just used our facility's sink for the cold water and then added an ice cube in there. And then for the hot water, you can do the same thing, just use your facility sink, and you just want to make sure that it doesn't get above 120 degrees. Anything above that can be dangerous. You might also want to consider who your population is. If it's a child or an elderly person, you may back that temperature down even further and not make it too hot. So I'm going to use these, and you can think about your Asia dermatomes, or you can think about the handout we used with the monofilament test to think about where you want to test someone. You can test every single dermatome again. You can also test the face. You can do the lower extremities also, but for the purposes of our testing, we're going to just focus on the forearm and on the hand. And so I'll take these dials, and so again her arm is laying on the table, and I'll let her look at this or feel this with her if she has an intact side. So this is going to be the warm side, okay, and this is going to be the cold.
Oh yeah.
Okay, so she can feel the difference there. For this test, again, I'm going to have you close your eyes.
Okay.
So you can occlude their vision, have them look away, or hopefully they can close their eyes. And you're going to test their different areas, and you're going to touch their skin about 3 times with each test. Okay, so are you ready to start?
Mm-hmm.
And just tell me if you feel hot or cold.
Cold,
Okay.
cold, cold. Hot, hot, hot. Cold.
Remember, when you come to, you're on the volar side of the hand, but you're trying to test radial sensation, you want to make sure you're on that lateral side.
Hot, hot, hot.
Her sensation is obviously intact, so she's feeling even with
Cold,
one touch. But
Cold.
someone who may be having more trouble
cold,
may require those 3 steps.
cold, cold, cold.
I could come back up to that C5 on the lateral elbow, or that T1 on the medial elbow, and test also.
Hot, hot, hot. Cold, 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 cold. Cold, cold, cold. Hot, hot, hot.
Okay.
Okay, so we're going to move on to the monofilament test, which is a light touch threshold test. It's more quantitative than perhaps the Q-tip or the dull portion of the safety pin. Up on the hub will be this document. Has some good information just about the procedures, the monofilaments themselves. On the back, it has some additional information explaining a little more about the color or the size of the monofilament. What I'm using today is a 5 monofilament set. There are some kits that are much larger, but a lot of times clinically it's easier to put a portable 5-piece in your pocket. I think you'll see this probably most often used. The smallest monofilament is the 2.83, and in some reference it's listed as green. Some people will use a pen that has multiple colors to shade according onto the hand the colors that correspond with the loss of sensation, or if they're normal, then you would see green. However, on this set, green isn't on here, okay? So some of the monofilament sets won't have that, but they'll have the size that corresponds. And basically, the monofilament is similar to what you would think of fishing line in just various diameters. So 2.83 is considered normal. And so what we're going to do is similar testing procedures before. Can have your client rest their hand onto some putty. That takes away the extraneous movement when you're actually applying the monofilament. Okay, this putty's a little awkward. All right. It helps if you're in a quiet place. However, hand clinics and rehab gyms are often not quiet. Particularly for this test, I would recommend that you do try to remove as much distraction as possible, okay, for your client. I tend to start with 3.61, which is one step above, it's your first step into abnormal, and it's a diminished light touch. I think one reason I start here is because oftentimes, particularly if somebody's had a hand injury, they may not feel that normal, so this gives them a chance of hopefully feeling something. It also gives me an idea which way I need to go in the monofilament set. Another thing that we run into in the hand clinic quite often, and you'll see in neuro population, you'll really see, particularly this part of the country, is highly calloused hands. A lot of our workers, folks that have a lot of callus buildup, okay? And so they will have trouble particularly feeling that normal, the 2.83. In that case, I think with clinical judgment, you just document that they do have a high presence of callus formation, okay? So the hand is placed so that we removed any extraneous movement. You'll ask the client to once again either close their eyes, they can look away if that helps, or you can hold a piece of paper or something up in front of them. All right? So let's do a little practice run here.
Eyes open or closed?
We're going to have you close your eyes.
Okay.
Similar pattern on the sheet here as far as ulnar side of the hand, okay? This form does add a thumb tip, which would be medial. Like before you saw, back here on the thumb would be radial. That's the only difference in this sheet compared to the other, okay? You ready? Mm-hmm. All right. So wiping the hand, it's almost like I'm erasing the chalkboard and now we've got a clean slate. And I will simply ask them to respond yes or no if I'm touching you.
Yes.
Okay. Yes or no?
Yes.
And yes or no?
No.
Okay. So for her, that's normal in her ulnar pattern. Okay, and you would repeat this in those sites for the different nerves. If she feels this, then there's no need to go down, okay, because we obviously know she's going to feel that. So what I would do, and I usually tell them, there may be a pause, you may hear me clicking a little, and that's just me changing filaments, okay? So once again, close your eyes. And I'm going to go right back where I was. Yes or no?
I don't know. I could only feel.
Sorry, that's a great point. It's so habit forming to lay the hand. Perfect. Is not to have other things touching them. Perfect. Yes or no?
Yes.
Yes or no?
Yes.
And yes or no?
Maybe. Yes.
Okay. So she felt the normal sensation. So on the chart, I would either document ulnar distribution with the normal limits. On this sheet, on the volar surface of the right hand, which would be this hand, I could mark the color green. All right. I'm going to show you, this is the highest filament, and you can definitely see the difference. And I have had folks that can't feel that. Okay, this one is not necessarily you're not gonna see the bend as well, okay? But you see the skin blanch underneath. If you continue to push this one as hard as you can, you're gonna push pretty hard before you get a bend. So on this one, I watch for blanching, okay? So it's really a matter of moving up and down in your monofilaments. And I will tend to complete one section before I move on. It's just easier for me to keep track if I'm, a particular nerve or particular area of the hand.
Mm-hmm.
Scar tissue, the presence of scars on the hand can alter some sensation. And that, once again, that's something you just need to document. If we can state the facts, and then if the doctor has an interpretation that's different, that's fine. But we can at least give them that scenario. Burn scars, of course, would be something else that could alter somebody's sensation.